For someone that hasn't been to Inspira here before, how do you describe it?
First impressions are lasting. So I feel that when a new person comes in, whether they're coming in to do a tour, to potentially look for placement for a loved one, that when they get here, we are attentive. We answer questions as needed. We like to make them feel comfortable when they get in the door. We like to offer them a coffee, sit down and ask them what their needs are, ask them what they're looking for in a facility so that we can address that and make sure that it's a smooth transition when they do come through the doors.
And in terms of needs, the services that you provide are pretty wide ranging.
They are. We obviously provide long-term care services. We also provide skilled services, all the therapies, speech, OT, PT. But we also do a little more. We get into some pretty high acuity patients as far as we do dialysis on site. We do take ventilators. We have ventilators on site. A lot of those types of patients require a lot of care. There's a lot of different comorbidities. For that reason, we also have developed, I mentioned earlier, our ancillary companies. We feel that the more you control, the more continuity there is of care. So when you're not passing somebody off to somebody else's company, it's people, our residents already know our staff. So when you have the same NPs coming in to do wound care, the same NPs coming in for the medical staff, you have the same people in the loop of care. And I think continuity and communication is just huge.